I think to a certain extent that's limited by the expense associated with whole genome sequencing. My understanding is that it's not very inexpensive to do. But yes, a part of that is because I think maybe the gravity of knowing these mutations is not fully comprehended and understood, because it may not necessarily convert to treatment outcomes or implications immediately, but one has to be far-sighted when it comes to these kinds of things. To a certain extent, that's limited by the expense associated with whole genome sequencing. My understanding is that it's not very inexpensive to do. But yes, a part of that is because I think maybe the gravity of knowing these mutations is not fully comprehended and understood, because it may not necessarily convert to treatment outcomes or implications immediately, but one has to be far-sighted when it comes to these kinds of things. Not really sure whether it's more deadly than the first time around, but we do know for a fact that it appears to be a lot more transmissible than the first time around. So the first time around, when the average rate of infection among close contacts was about 10 to 15%, which meant that in a family of five, for every 5 individuals who were exposed to a patient, 1 would get infected. This time around, we are clearly seeing entire families, entire workspaces, people attending a marriage ceremony, for example, a significant proportion of them turning positive, which suggests that it's highly transmissible. And I think when that denominator becomes as huge as it is right now, even if a small proportion of individuals need hospitalization, need intensive care, that converts to a whopping number. And I think that's what we're really seeing. I don't think we're absolutely convinced that it's a more lethal variant of the virus yet. I think viruses are known to mutate. Coronaviruses are going to keep mutating with time. And I think the most efficient way to prevent that is mass and rapid vaccination. So I think if you vaccinate enough individuals, you prevent this constant cycles of transmission. And transmission is eventually associated with mutants. This is called selection pressure mutants that develop. If people are vaccinated enough and that transmission cycle is broken, I think we would succeed in preventing the emergence of new mutants and variants. Full at the moment, but I think things are changing. I think there's aid which is coming from the US. The US is sending us a whole stock of vaccines, which we're very optimistic and hopeful about. I think there were certain supply chain hurdles which have been cleared at the moment, and hopefully that will allow us to ramp up production. I think the government has also provided some sort of an incentive in terms of funds to the vaccine manufacturers to scale up. If they do it fast enough, I think there is hope around the corner. I think the other vaccines have also been put on a fast track for approval. So the more the number of vaccines that enter the country, I think greater the probability of us being able to scale up vaccination. So I know for a fact that the state of Maharashtra, the state in which I practice, is kind of plateauing out over the past 4 or 5 days. It does appear that the number of new infections appear to be plateauing out. Of course, we know that mortality, deaths tend to lag by about 2 or 3 weeks. So, unfortunately, I think the need for critical care beds, the need for ventilators has still not peaked, unfortunately, in the city of Mumbai. If you look at the trends from last year, the state of Maharashtra and the city of Mumbai were the worst affected initially, and then the rest of the country followed suit. But so did the recovery patterns. So based on the recovery patterns that I'm seeing in Mumbai and in the state of Maharashtra, there is reason to be optimistic that within the next 2 or 3 weeks, hopefully the rest of the country will follow as well. I think mistakes were made all around. I think in hindsight, a lot of people probably regret a lot of things that they did in terms of lowering their guard, in terms of gatherings that occurred, which possibly should not have happened, given the fact that we know over the past 1 year that gatherings of people in closed spaces, in crowded spaces, and close contact of a whole bunch of individuals is the most efficient way of spread. So in hindsight, I do think that we could have done a better job in preventing spread at a mass level, at an individual level as well. I think we got very optimistic and complacent after the numbers went to an all-time low in the months of December and January, after we survived through Diwali, after we survived through New Year's without seeing spikes. I think all of us collectively let our guard down, and I think we're paying the price for that. So yes, this could have been prevented to a certain extent, but I mean, right. That's what we're realizing in hindsight now, unfortunately. I think all of us are stretched thin over the past year. I think we don't see light at the end of the tunnel, which is a very difficult circumstance to work under when, every time you see a glimmer of hope, unfortunately, there is another wave that pulls you down. I think all of us are close to our to the end of our patience, to the end of our resilience. I think all of us are a lot more irritable and a lot less patient than we used to be last year. But that's just the way it is, I think.